Interpreting genetic test results. What is CF carrier status? Cystic fibrosis carrier status refers to a person who has one changed copy of the cystic fibrosis transmembrane conductance regulator gene but does not have the disease itself. Cystic fibrosis occurs when both copies of this gene are mutated, one inherited from each parent. Carriers have one normal gene and one mutated gene, which is not enough to cause any symptoms or health issues related to cystic fibrosis. Most carriers do not show signs of the disease, but they can pass the mutated gene to their children. This means that if a child inherits one mutated CFTR gene and one normal gene, they will be a carrier as well. If a child inherits two mutated copies, one from each parent, they will develop cystic fibrosis. If a child inherits two normal copies, they will neither have cystic fibrosis nor be a carrier. Carrier testing is typically performed through a blood test that screens 4 common mutations in the CFTR gene. While this test can identify most carriers, it does not catch all possible mutations. Therefore, a negative test result does lower the chances of being a carrier, but it does not completely eliminate that possibility. Cystic fibrosis follows an autosomal recessive inheritance pattern. This means that if both parents are carriers, there is a 25% chance for each child to have cystic fibrosis, a 50% chance of being a carrier, and a 25% chance of neither carrying the mutation nor having the disease. If one parent is a carrier and the other is not, there is a 50% chance for each child to be a carrier and a 50% chance of not carrying the mutation. If neither parent is a carrier, it is very unlikely for the child to have cystic fibrosis or be a carrier. Understanding carrier status is crucial for family planning. If someone is identified as a carrier, their partner can also be tested to determine the risk of having a child with cystic fibrosis. If both partners are carriers, genetic counseling is recommended to discuss reproductive options and prenatal testing. In summary, being a cystic fibrosis carrier means having one mutated CFTR gene without having the disease. Carriers typically do not experience symptoms but can pass the mutation to their children. Genetic testing is a valuable tool for identifying carriers and assessing the risk of cystic fibrosis in future generations. Understanding carrier status plays a significant role in genetic counseling and family planning for those affected by cystic fibrosis.